Hi, today we will discuss some of the important questions in Pharmacology Unit 1, that is General Pharmacology. The first question is define drug. The answer is according to WHO, drug is any substance or product that is used or intended to be used or modify or explore physiological system or pathological states for the benefit of recipient. This is the definition for drug. Second question is define pharmacokinetics. So it is the study of the absorption, distribution, metabolism and excretion of the drug. That is, in simple way we can tell what the body does to the drug. Okay, what the body does to the drug, that is pharmacokinetics, and kinesis means movement. Question number 3, define pharmacodynamics. So pharmacodynamics is the study of the effect of the drug on the body and their mechanism of action. That is what the drug does to the body. Don't get confused with pharmacodynamics and pharmacokinetics. So kinetics means absorption, distribution, metabolism and excretion. That is what the body does to the drug. Okay, that is movement of the drug. And dynamics means it is the effect of the effect of the drug on the body and the mechanism of action, that is what the drug does to the body. Next is pharmacovigilance. So it is the study and activities relating to the detection, assessment, understanding and prevention of adverse effects or any other drug related problems. It deals with the epidemiologic study of the adverse drug effect. So it deals with the adverse effect of drugs. Next is list down the source of drug, which is an important question that is repeatedly asked. So the source of drug we can classify broadly into natural and synthetic source, and in natural source it comes plant source, animal, mineral, microorganisms and human source. In synthetic source, chemical synthesis like other technique like cell culture, recombinant DNA technology, hybridoma technique where the antibodies like monoclonal antibodies are produced. So these are the techniques. Okay, for the source of drug it is classified into two, that is natural and synthetic. In natural, plant, animals, minerals, microorganisms, human will come. Then in synthetic, chemical synthesis and other techniques like DNA technique, cell culture and hybridoma technique will come. Next is list down few drugs prepared from plant source. Examples are atropine, morphine, quinine, digoxin and pilocarpine. Next, list down few drugs prepared from animal source, that is insulin, heparin, gonadotropins and antitoxic serum. Next question, list down few drugs prepared from minerals, that is magnesium sulfate, aluminum hydroxide, iron, sulfur and radioactive isotopes. Next question, list down few drugs prepared biotechnologically. First is urokinase. It is cultured from human kidney cell. And second example is human insulin, as we know, recombinant DNA technology. Then this is an important question. Explain the routes of drug administration. So we have to explain each and every route. So generally we know that it is classified into systemic route and local route. In systemic route, the drug is classified into like the route of administration comes like enteral and parenteral. So in enteral route, oral route, sublingual route and rectal route we can administer medication. When it comes in parenteral, inhalational and inhalational, injection and transdermal patches like are there. So in injection, as we all know, intravenous, intramuscular, subcutaneous, intraarterial, intraarticular, intrathecal and intradermal routes are there. When it comes to the local routes of drug administration, topical skin applications are there, intranasal applications, ocular drops are there, mucosal throat, vagina, mouth, ear routes are there, and inhalational and transdermal patches also comes under local drug route. Okay. Next question. This is an important question. The routes of drug administration. So generally it is classified as systemic and local. Then the systemic route of drug administration, enteral and parenteral. So in parenteral it is very important injection. So intravenous, intramuscular, subcutaneous, intraarticular, intraarticular, arterial, intrathecal, intradermal. Then inhalational and transdermal routes are there. So next is dash is administered at a high velocity where the jet of drug solution is projected from a fine orifice using a gun. This is a rare question. So we will see the answer. The answer is dermojet, which is suitable for vaccine. So dermojet is administered at a high velocity where the jet of drug solution is projected from a fine orifice using a gun. Okay, here we can see the picture of a dermojet. Usually it is suitable for vaccine. So next question is, dash is the form of drug administration where the drugs are packed as pellets and are implanted subcutaneously. Dash is the form of drug where the administration where the drugs are packed as pellets and are implanted subcutaneously. The answer is pellet implantation. So usually the hormonal treatment like testosterone and all will be administering using pellet implantation. So the drug it will be effective for 1 to 2 weeks. Okay, so the 1 to 2 weeks implantation we use pellet form. So next question, dash are implants that are packed as tubes and implanted subcutaneously, which get absorbed over months to provide constant blood levels. Dash are implants that are packed as tubes and are implanted subcutaneously. So the answer is silastic implant. So here the drug is packed in silastic tubes and are implanted subcutaneously. Okay, the drug gets absorbed over months to provide a constant blood levels. That is hormones and contraceptives. Okay, the empty non-biodegradable implant has to be removed. So this is the picture for silastic implant. So when it comes into pellet implantation, small pellets packed with drugs, it will be implanted subcutaneously. The drug is slowly released for weeks or months to provide a constant blood levels. Like examples like testosterone or desoxycorticosterone acetate, all these drugs will be implanted in this form. Next question is, drug injected directly into a joint is known as dash route. Drug injected directly into a joint. Okay, don't get confused. Joint. Okay, so the answer is intra-articular route. Okay, it is used in the treatment of arthritis and other diseases of joint. Intra-articular route, that is where we injected drug into joint. Okay. Next, drug administered into the subarachnoid space for action on central nervous system is called as dash route of drug administration. Administered into subarachnoid space for action on central nervous system is called dash route of drug administration. The answer is intrathecal route, that is spinal anesthetic. Okay, usually we give spinal anesthetic in this. So drugs can be injected into the subarachnoid space for the action on central nervous system, and spinal anesthetic, some antibiotics and corticosteroid are also injected by this route to produce high local concentration. So the nursing role is, here we have to maintain strict aseptic precaution. Okay, strict aseptic method procedure we have to follow. And the last question is, injection of drug into the bone marrow is known as into the bone marrow. The answer is intramedullary route. Okay, this route involves injection into bone marrow. So now this route is rarely used, but as a precaution, expiry date of the preparations are to be checked, and oil-based injection should not be mixed with any other injection. That is the general nursing responsibility. Hope you have understood. Thank you.